Is knee osteoarthritis slowing you down? Maybe you've had pain in your knee, you went and got an x-ray or an MRI from the doctor, and now the surgeon is recommending surgery, but you're not sure if you actually want to do that or not, and you're trying to figure out what other options are available to help you with knee osteoarthritis. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and we are empowering women with changing bodies to move pain-free. And that includes women with osteoarthritis in their knees. Let me tell you a story to explain why this is so very important to me. I had a patient who had come in after a fall on both her knees. So she was hiking, she tripped, and she fell straight on both knees. And she could no longer walk, she could no longer hike. I mean, even doing housework was really difficult for her. So, of course, logically, she went to the doctor. The doctor did some x-rays and said that you have knee osteoarthritis, and the only way to fix this problem is to have knee surgery. Now, here's the thing. She had the osteoarthritis before she fell on her knees. I'm going to explain more about that in this video. We were able to get her back to walking, back to hiking, and of course doing all of her day-to-day activities pain-free, including painting her entire house. Did we fix the knee osteoarthritis? Well, we didn't change what was happening in the joint, but we did change the pain and her quality of life. So we'll talk about what is knee osteoarthritis, why it might be causing you pain, as well as some simple things you can do, including what I did with this patient to help her get pain-free with her knee osteoarthritis. All right, first step, what is knee osteoarthritis? Knee osteoarthritis is when there's abnormal bony formation within the knee joint. You see, what happens is there's cartilage, which is like this spongy cushion that is in all knee joints, and it helps to protect the bones so that they can move easily or glide over each other instead of crunching on each other. What can happen is if you're moving incorrectly, this can cause the cartilage in the joint to be damaged. As the body tries to heal that, it will lay down bone in that area instead of cartilage. So instead of that soft, squishy substance, now you have bone, which is a much harder surface. Over time, if you get enough of that bone forming, you will end up with knee osteoarthritis. Now, here's the thing. The research is super clear that if you're over the age of 30, chances are good you have some knee osteoarthritis. But just because it's common doesn't mean it's normal. You see, the cartilage in every single joint, and especially the knee joint, is designed to be able to heal itself as long as it's moving correctly. And we'll get to what does moving correctly look later on in this video. So what are the common symptoms of knee osteoarthritis? Most commonly, it is a dull, achy pain in the knees that increases after activity. So you see, as you're moving, it's helping to decrease the inflammation in the short term because it's pumping that inflammation out of the joint. However, since your movement pattern is probably not correct, then a couple of hours after the activity, you will notice a dull, achy type of pain. Occasionally, as it progresses, you will get a sharp pain actually while you're walking, but most commonly, it starts as a dull, achy pain. If it starts as a sharp pain, most likely that's more of a nerve issue in the nerves that are surrounding the knee joint. Now, a lot of people, before they even have any kind of pain, have like a crunching or grinding sound in the joint. This is most noticeable when you're doing things like going upstairs or doing squats, and you have this grindy type of noise. Chances are good you have some form of mild knee osteoarthritis at this point. Now, if you're saying that's me, stay tuned because we're going to talk about what you should be doing at this point to keep your knee osteoarthritis from progressing. Now, the most common misconception that I see is that people go to the doctor, get an x-ray, are told it's bone on bone, and the only option is to have surgery. So the patient I talked about earlier, that's exactly what she was told. It's bone on bone, and there's no way to heal this unless you have surgery. So my question to her was, what does healing look like for you? You see, the truth of the matter is I cannot fix knee osteoarthritis. It is an abnormal bony formation, so I can't necessarily change that. But I can change the pain perception by decreasing the inflammation in the joint. So if your definition of healing is being able to get back to your regularly scheduled programming, then there are things that can be done for that. If you actually want to fix the knee osteoarthritis itself and feel that's the only answer for you, then yes, surgery would be the only answer, because there's nothing that you can do to actually fix knee osteoarthritis. You can stop it from progressing. You can get it to be pain-free, but you're not going to actually change what's happening in the joint. So what are the key strategies that you need to implement to stop the progression of knee osteoarthritis and get to moving pain-free? To answer that, we want to consider, how did this knee osteoarthritis start in the first place? Knee osteoarthritis most commonly starts for one of two reasons. One, the knee joint is not moving correctly, or two, there's not enough strength in the knee joint to support the activities that you want to do. Which means the solution is relatively simple in that we want to improve the movement in the joint so that this doesn't progress any further. And we want to strengthen that joint to keep the knee osteoarthritis from progressing moving forward. Now, for some people, and most of the people I see in the clinic, their movement pattern has become so abnormal that they're not actually able to fix it on their own. That's when you need the help of a really good manual physical therapist to help you restore that normal movement pattern, because every tissue in your body is designed to heal as long as it's moving correctly. But I want to give you some ideas of things that you can be using on your own, or even things that you could talk to your physical therapist about. The first thing would be, what is the best cardiovascular exercise for knee osteoarthritis? So my favorite cardio exercise for knee osteoarthritis is swimming. You are going to have that decreased weight bearing, which decreases the force on the knee, so you're not going to be progressing any knee osteoarthritis, and you get that normal movement of the knee through a small range of motion while you're swimming. Now that's important because you don't want to be putting any abnormal forces through the knee. So swimming is a great option to help decrease the force as well as improve the motion in the knee. My second favorite cardiovascular exercise for people who have knee osteoarthritis is biking. Even a stationary bike counts, because what happens is you're able to move that knee through a greater range of motion, so you have more motion in your knee as you're riding the bike, which allows for normal lubrication of that knee joint and will help keep the cartilage from getting further degenerated. Now, if swimming's not for you, maybe you don't have access to a bike, then my third favorite cardiovascular exercise for knee osteoarthritis is using the elliptical. You see, you are on your feet at this point, so you do have that weight bearing or that gravity pushing down through the top of your head. However, your feet are planted on the pedals as you're moving forward, which means you get a lot of motion through the ankle and through the knee, which helps with gliding, and that will allow the cartilage to get more plump, so you have decreased symptoms from your knee osteoarthritis. Now, how do you increase strength in your legs to help decrease the symptoms of knee osteoarthritis? Well, most people will feel like, I need to work on my quads, which are the big muscles in the front of the thigh, because those muscles cross the knee joint. And I understand that makes sense. However, most people who have knee osteoarthritis are actually quad dominant, which means they overuse their quads and they underutilize their hamstrings, the muscles on the back of the thigh, and their glutes, which are the muscles in your butt. So if you're looking for strengthening exercises to help with your knee osteoarthritis, I'm going to recommend that you actually start working on your glutes first. Depending on where you are on your journey, you can start with things like glute squeezes while you're sitting or while you're lying down. You can do exercises like bridges to help really activate those glutes. And as they get stronger, you can do things like squats, where you're going to be getting more of that glute activation. And squats are great for the glutes, and I absolutely love them. However, most people with knee osteoarthritis cannot do a squat correctly because they have knee pain. So you need to focus on that cardiovascular exercise to get the knee joint moving more correctly so that you can tolerate a higher level activity such as a squat pain-free. Because any exercise that you do that increases your pain is not going to help with healing. You see, when you're having pain, when you're exercise, and I'm talking about a reproduction of your pain. Yes, if you're doing a high-level strengthening exercise, there can be some soreness that comes along with this, but I'm talking about a reproduction of your symptoms. If you are having that, then what happens is it actually causes the muscles to tighten. Most commonly, in this case, it will cause the quads to tighten. And if your quads tighten, that increases the compression in the knee joint, which is exactly what we do not want, because that's what got us here in the first place. Now, if you're looking for some exercises that you can do for knee osteoarthritis, I'm going to recommend you check out this video over here. It's the video that has all the exercises that I did to increase my hip strength as I was preparing for the Dopey 2025. And all of them will be effective in helping to decrease your symptoms of your knee osteoarthritis, but they may not all be tolerated at this point. So you have to do the exercises that you can tolerate without increasing your pain. So, how does physical therapy help to decrease knee osteoarthritis? So, a physical therapist is going to look at your movement pattern and do what is required to change that, as well as put you through a monitored program to help improve your cardiovascular fitness, as well as increase the strength. So, they'll do things like testing your strength in your legs, finding out if you're quad dominant, helping you to be able to activate your glutes and decrease your symptoms over time. The goal of physical therapy really in this case is going to be giving you that program that you're going to continue for the long term. Now, if you see a manual physical therapist, such as myself, they're also going to be focused on decreasing your pain and inflammation while you're in the clinic. Because let's face it, it's way easier to exercise if you're not in chronic pain. And please hear this point. You should not be doing any exercises that increase your pain when you have knee osteoarthritis. It will make your symptoms worse. It will make your osteoarthritis worse. It is very important that you have exercises that are specifically designed for you to help decrease your pain and increase your normal movement pattern. There's also some holistic things that you can be doing that we discuss here in the clinic a lot, which includes diet. Now, I understand I'm a physical therapist and I cannot make recommendations specifically regarding your diet. However, we know that if you have any form of arthritis, you have increased inflammation. So doing things like implementing a low inflammation diet will help to decrease your pain and your symptoms of knee osteoarthritis. It may even help other joints that are painful at this time. And another thing that you really need to consider, particularly if you're trying to avoid surgery for knee osteoarthritis, is it is entirely possible. I have seen multiple patients in this clinic who were bone on bone. It was proven on x-ray. The surgeon said the only way to become pain-free is to have surgery and have a total knee replacement. And I have successfully got them back to activities, including running, including hiking, including all the things that were important in their life, even kneeling to be able to do their gardening. So yes, it is entirely possible. However, you have to have a mindset that believes that it's entirely possible. It doesn't matter what clinic you walk into. If you walk in there with the mindset of the doctor says I have to have knee surgery and there's nothing I can do about it, I'm just here so you can prove me right, I guarantee you it doesn't matter how good your physical therapist is, they are going to prove you right. In fact, when I have patients who walk in here and they're like, I just have to do physical therapy before they're going to allow me to get surgery, then I don't treat them because I cannot help those people who have already decided that surgery is what they need. I wish them well. I hope that their surgery goes well. I hope that their recovery goes well afterwards. And if you need me after you've fully recovered from your surgery, I would be happy to help you at that point. However, nobody can change your mindset except for you. So if you truly believe that knee surgery is the only thing that is going to help get rid of your osteoarthritis, then I encourage you to pursue that path because that's the path that is going to work best for you. Everybody's different. However, If your goal is to avoid knee surgery and you want to know if having bone-on-bone knee osteoarthritis, if you can still get back to all the activities that you love doing without surgery, I'm here to tell you a resounding yes, you can. I have seen it hundreds of times in my clinic. You just need to find someone who can guide you through that process and do what your body needs to get back normal movement and strength to prevent knee osteoarthritis from slowing you down. If this video was helpful for you, give it a thumbs up. If you like this kind of content, go ahead and hit subscribe. And if you're looking for those exercises that I did to help increase my hip strength in preparation for the Dopey 2025, we're going to link that right over here.